Welcome to the HEOR Insights YouTube channel.
In this explainer, we're going to cover everything you need to know about HTA submission searching. We'll start with the basics, what it is. Then we'll walk through the process step by step. After that, we'll touch on the key agencies you need to know, look at how this skill is actually used in HEOR, and finish up with some common mistakes and key takeaways.
All right, let's start with Section 1. What exactly is HTA searching?
So, at its core, HTA submission searching is a systematic process, but it's very different from, say, a PubMed search for clinical trials. Here, you're specifically targeting what we call gray literature. These are the official reports and decision summaries that HTA agencies, the national payers, publish when they evaluate a new drug or medical device.
You can think about evidence in HEOR as existing in two states. On one hand, you have the academic literature. This is like the marketing view. It's peer-reviewed, but it's often a high-level summary. On the other hand, you have the HTA dossiers. This is the engineering view. We're talking hundreds of pages that lay out every single detail of the economic model and the data sources. HTA searching is how we get access to that deep, engineering-level detail.
So when you conduct an HTA search, you're usually looking for three key documents. First is the manufacturer's submission. That's the company's argument. Second is the final guidance, which is the agency's decision. But honestly, the most valuable piece is often the ERG, or Evidence Review Group Report. This is an independent, academic critique that digs into the manufacturer's methods and really validates their work.
Okay, let's move on to Section 2.
How do you actually do this? What's the workflow?
We can really break the process down into four main steps. First, you identify which HTA agencies are relevant. Then you define your search parameters. What drug, what disease. Third, you navigate their websites to find and download the documents. And finally, you extract the key data you need from those reports.
Now, that last step, data extraction, is critical. You're not just reading, you're looking for specific things. What was the comparator drug they used? What kind of model did they build? Was a lifetime horizon okayed by the agency? Where did they get their utility values? And of course, what was the final outcome and why? Was the drug rejected because the ICER was just too high? These are the details that inform all your future work.
Let's dive into Section 3, where we'll look at some of the key HTA agencies around the world. It's really important to understand that not all agencies are the same. For instance, NICE in the UK is very focused on cost-utility analysis. That's the cost per QALY. But if you look at IQIG in Germany, they don't use QALYs at all. Their focus is purely on the added clinical benefit. Knowing these differences and knowing which key document to look for from each agency, like the ERG report from NICE or the public summary document from Australia's PBAC, is crucial.
So that's the theory. Section 4 is all about how this actually gets used in the day-to-day world of HEOR.
This isn't just an academic exercise. HTS searching is a core competency that directly informs strategy and execution in HEOR. Let's look at a few examples.
First up is feasibility assessment. Let's say you're working on a new gene therapy and you want to model a lifetime cure. Before you spend months building that model, you do an HTA search to see if any agency has accepted that kind of assumption before. If it's been rejected in the past, you already know you need a backup plan.
Second, it's a fantastic way to source your model inputs. If you find a past ERG report that specifically says a certain study is the best source for utility values in your disease area, well, using that same source in your model is a no-brainer. It's like it's been pre-approved by the agency, which dramatically lowers your risk of getting criticized on that point.
The third application is competitive intelligence. By carefully analyzing your competitors' submission documents, you can find the weak spots in their evidence. Maybe they relied on surrogate endpoints because they didn't have overall survival data. If your product does have that data, that becomes a major strategic advantage for your own submission.
And finally, this skill is absolutely vital for objection handling. If you review past HTA reports in a specific disease, you'll start to see patterns in the committee's criticisms. This allows you to anticipate their questions and proactively build a really solid defense for those points before you even submit your dossier.
All right, let's wrap this up with our final section on common pitfalls and the main takeaways you should remember. There are three mistakes I see people make all the time. First, they confuse the draft guidance with the final guidance. The decision can and often does change. Second, they assume that a yes from one country means a yes everywhere else. It doesn't. And third, they see the word recommended and miss the fine print that limits it to a tiny subpopulation of patients. Always check the details.
If you take one thing away from this, let it be this quote. It really sums up the whole philosophy. Before you start any technical work, whether it's building a model or choosing an input, you first search for the precedent that's already been set by these key agencies.
At the end of the day, HTA submission searching is really the detective work of HEOR. You're getting access to thousands of hours of expert analysis and critique that's already been done. So many of the complex methodological questions you'll face have probably already been answered. They're just sitting there waiting for you to find them in a PDF on an agency website. That's why this is such a powerful and indispensable